Hello everyone, hello doctors. So the topic now is again important for us, which we are using in our day-to-day life. Very confusing which one to use as we get so many in the market. So that is luting agents and the luting cements. So introducing luting cements. Luting cements is what? Cement is anything that is binding to the tooth structure as well as with that of the restoration. And luting, what does the word luting means? Luting is something which can lute between two. Lute is fix between any two. Restoration, fill up the space between any two present area. That is the reason why it is called luting cements. So luting cement, is it different from restorative cement? Yes, it is different. How is it that different? Because luting cement's film thickness will be only 25 micrometers, whereas that of a restorative cement, the film thickness will go up to around 40 micrometers. So everything has to have ideal properties. So Dr. McLean and Wilson gave certain amount of ideal properties of a luting cement. Like for example, low viscosity, the film thickness should be 25 micrometers as I told you. Long working time should be there. The solubility should be less, and also it should settle very fast in the mouth. The working time should be more, setting time should be less. Good resistance to any aqueous or acid attack, high compression and tensile strength should be present. Resistance to any plastic deformation happening in the oral cavity should be taken over by the luting agents. Adhesion to the tooth structure and restoration, it should have a karyostatic activity. That is, it should not allow the caries to grow. Static, it should stop it over there. Biological compatibility with that of the pulp should be present. So it should not be irritant. It should not be any inherent property of chemical or thermal irritation to the pulp. It should be translucent, because in case we are giving an all ceramic crowns and the luting cement is only taking the color, that is also called chameleon's effect. So if that is happening, so then our restoration shade is gonna go mismatch, and it will not match with that of the shade that we have selected, because the luting cement will give its own shade out. So it should be translucent, and it of course should be radio opaque. Why is that important? It should be radio opaque because when you are making an IOPA or an X-ray later on after the restoration has been placed to find out if that particular cement is there in the gingiva anywhere, if it is there, then that is going to give harmful effects in the gingiva. So then it is very important for us to also know that the cement is left over or not. So it has to be radio opaque for that. So coming to the choice of luting agents, there are different luting agents. There can be temporary luting, there can be permanent luting agents, there are active luting agents, there are passive luting agents. What is active and passive luting agents? Active luting agent which actively binds with the tooth structure like zinc phosphate, GIC. Passive luting agent which slightly binds to it, like the temporary restoration, that is the zinc oxide eugenol or eugenol free zinc oxide cements. So which are we supposed to use? So for that we need to know what are the different cements, what are their properties, how are they useful, and how is that bad for us. Do we exactly know that McLean sir gave us so many ideal characteristics, but till date in 2017 as well, we do not have a single cement which fulfills all the characteristics, and that is very ironical on the part of the commercial market for the luting agents. Coming to the composition of zinc phosphate cement. Now coming to zinc phosphate cement. Zinc phosphate cement is comprising of zinc oxide as well as an aqueous solution of phosphoric acid. Name suggests. Forget about all that. Before that, let us know what zinc phosphate is important to us. Zinc phosphate is the oldest cement ever possible. There was a first cement which came across for the luting cements as a luting cement in the years of 1800s. Now that zinc phosphate is taken as a gold standard. Whatever cement is coming out, we compare it with the bond strength of zinc phosphate. We compare it with the bond strength of zinc phosphate. We compare it with the tensile strength of zinc phosphate, the pulp reaction of the zinc phosphate, the acidity with the zinc phosphate. So zinc phosphate has become the gold standard in the luting cements. So, according to area specification number 8, it is classified into two types, type 1 and type 2. The type 1 is for the luting and type 2 is for restoration. Almost all cements are classified as the same. Now coming to the composition of it. Now zinc phosphate has got zinc oxide, a powder and a liquid, which has to be mixed as every cement has got. So powder consists of zinc oxide, which is of 90%, magnesium oxide, that is around 8.2%. Now this magnesium oxide, it decreases the temperature of calcination. In return, it helps in the powder composition of the zinc phosphate. Silicon dioxide, it has 1.4%, and this acts as a filler in the composition of zinc phosphate. Then we have bismuth oxide, Bi2O3, that is 1%. I'm mistaken, it is Bi2O2, that is 1%, that imparts smoothness in the particular restoration of zinc phosphate. Coming to the liquid per se, we have phosphoric acid, that is 38.2%. We have water content, that is 36%. We have phosphoric acid with water, 16.2%. We have some traces of zinc and aluminium. Both helps in the buffering agent, reduces the activity of powder and the liquid. Now, how does this reaction goes about? Zinc oxide reacts with phosphoric acid and there is a zinc phosphate amorphous solution which is formed. Some amount of unreactive zinc oxide also stays back in this particular reaction which happens. Now, how are we supposed to manipulate this particular reaction? So, manipulation is with the help of a cool glass slab. I remind you again, cool, dry glass slab. It should be cool, but not very cool, or it should not be wet. It should not be dry, because if it is more than wet, if it is wet, what will happen? So we are not supposed to go below the dew point, that is 14 degrees Celsius, 18 to 24 degrees Celsius. We are not supposed to go below that. We are supposed to keep it within that. And if it is not cool, then the reaction will not take place fast, because water particles, if it is remaining in the glass, that will again react with the powder liquid ratio and will change the ratio, and it will also hamper in the reaction of the zinc oxide region, zinc phosphate. Coming to the working time and setting time of this particular cement, it is 2.5 to 8 minutes for 37 degrees Celsius, and the first 60 to 90 seconds this remains the same. Coming to the powder liquid ratio, it is 1.4 grams per 0.5 ml of liquid that is present. Coming to the characteristic features. Now, zinc phosphate is good cement, no doubt. But immediately after the placement of zinc phosphate, the acidic level is 2.4, that is, it is acidic. So later on, with an hour or so, it reaches to 4.2. With 48 hours, it reaches to some neutrality value of the cement. So till it is acidic, it is harmful for our pulp. So it is not very good as a biocompatible material. The compressive strength remaining very nice, that is 104 megapascals. Diametral tensile strength goes up to 5.5 metapascal, whereas the modulus of elasticity, that is the strength of the material, is again very beautiful. It is 13 gigapascal. Coming to the advantages and disadvantages of this material. The advantages of this material is the zinc phosphate cement. It is a long record of clinical reliability. It has been used for years together, and it was one of the most oldest cement that we know today. It is easy to use, as usual, easy of cleaning up as well, and adequate compressive strength is present in this material. We have also got adjustable working time and acceptable film thickness, that is near about 25 micrometers for the Luting cement. But what comes as a disadvantage with this package? The disadvantage is what I told you before, the pulp reaction, because initially the pH is very acidic. So once the pH is acidic, what happens? It gives pulp reactions. Also, it has got high solubility in the oral fluids, and also it has got the potential for pulp irritation because of the pH. Not only that, it has also some allergens which can cause allergy to that particular tooth, also to the gingiva, and lack of anti-karyogenic any element in that. So it is not a karyostatic cement that we know. Lack of any anti-karyogenic effect, it doesn't have any karyostatic effect. The cement doesn't have any karyostatic effect. But though we use it in luting of braces, orthodontic braces, luting of still for luting permanent restorations, we still use zinc phosphate cement. Coming to the next, which is the zinc polycarboxylate cement. Now, zinc polycarboxylate cement, as the name itself is suggesting, somewhere zinc oxide and polycarboxylic acid. So carboxylic acid is going to mix with that. So the powder, what will it contain? It will contain zinc oxide and magnesium oxide. It will contain stannic acid. Maybe substitute for the magnesium oxide as in case of zinc phosphate cement. Stannous fluoride. What does stannous fluoride do? Stannous fluoride is increasing the strength of the particular cement, the material. Mixed with the water contains 15% to 18% of polyacrylic acid. As the name is saying, it is zinc polycarboxylic cement coated with the oxide particles, of course. Now the powder liquid ratio remains to be 1.5. Coming to the properties of the polycarboxylate cement, zinc polycarboxylate cement. Film thickness, yes, it of course remains to 25 micrometer, even less than that. The working time we get is 2.5 minutes for 6 to 9 minutes. It goes on, that is the setting time of the particular cement. Coming to the mechanical properties, before that we will discuss about the viscosity. It has got low viscosity for sure, but the solubility is little high in this case as well. The compressive strength is 55 megapascal. The diametral tensile strength is again good enough. It has got a good modulus of elasticity present. Zinc polycarboxylate cement is not as brittle as that of zinc phosphate, which was the main problem with zinc phosphate, that it had no strength. Whereas here stannic acid is giving good strength to the material, and solubility of course is one of the another good factor. Coming to the pulp response of the zinc polycarboxylate cement, it has got a mild pulp response more than that of the zinc phosphate cement. Why is that so? Now the temperature, the pH that the zinc polycarboxylate rises is 2.5. Initially it is also acidic. It raises out to 6 pH in about 48 hours. So near about the same what is happening with zinc phosphate. So why is that? Why is this have a mild response to the pulp? Because the particle size of zinc polycarboxylate is very high. It is more bigger in structure. So it cannot go inside the dentinal tubules to reach the pulp. So hence the mild response to the pulp is there. It cannot go to the pulp. So how will it get response to the pulp? So that's why it's little better than the zinc phosphate cement compared to the pulp responses. So coming to the advantages and disadvantages, it is a luting of permanent alloys, of course, reaction as a base. Now coming to the advantages and disadvantages. The advantages being it is a less irritation, can be chemical adhesion is there in this, and the strength of this material is fair enough because of the film thickness which is comparable to zinc phosphate, that is 25 micrometer. Whereas the disadvantages remain is it needs accurate proportioning, the mixture requires a proper manipulation, it also requires a lower compressive strength and a greater viscoelasticity. So if the viscoelasticity is more, what will happen? It will be percolating outside the restoration that we will give. So that's again bad for the gingiva because initially it has a very acidic pH. And need for clean the surface to utilize the adhesion. So these are the disadvantages related to zinc phosphate, So these are the disadvantages related to zinc polycarboxylate cement. Coming to the next important boom in dentistry, that is glass ionomer cement. So glass ionomer cement, which came up very recently in dentistry, has also been known as polyalkanoic acid. This is a very important cement for luting agent, as luting agent is concerned. And why is that so? We will come across very soon. That is because of the most important invention into it, that is a fluoride. So glass ionomer cement is classified into 3 types. Type 1, not only 3 types, has got 8-9 types of classification, which we are concerned as a luting cement is a type 1. I always told you luting cements are always type 1, restoratives are type 2. So the powder liquid ratio here remains for luting is 1.5:1. For restorative it remains 3:1. Type 3 is liners and bases, where it is again 1.5:1. And powder liquid ratio for bases requires is 3:1. Type 4 it is metal modified glass ionomer cement, that is miracle mix. We have cement, Cermet cement. We have light curable variety of GIC resins as well. Then hybrid glass ionomers, we have resin modified glass ionomer cements. Resin modified, the resin has been added, the matrix resin is added in those kind of cements. Coming to the composition of glass ionomer cement, the powder consists of SiO2, Al2O3, AlF3, CaF2 and AlPO4, that is silicon dioxide. We have aluminium phosphate, aluminium oxide, we have aluminium fluoride. Fluoride is a karyostatic agent here. Calcium fluoride, we have aluminium phosphate. So fluoride is an essential constituent of glass ionomous cement, as we told earlier as well, and that helps. And what is the maximum content of the powder? That is calcium fluoride. So fluoride is more in number. Coming to the liquid part, it is an aqueous solution of polyacrylic acid, mainly 50% copolymer with itaconic acid, malic acid and tricarboxylic acid, tartaric acids. Now coming, how is the setting reaction which goes about? The setting reaction goes in 3 stages. First is dissolution, then comes precipitation and then the hardening. How does dissolution happens? When polyacrylic acid with the help of hydrogen ions is liberated into the powder form, there are 3 ions which are coming out. There is a calcium, aluminium and fluoride. Among the calcium, aluminium and fluoride ions which are released, the calcium ion among these 3 ions have more reactivity than the aluminium ion. So it will react with the polyacid liquid, that is the COH. So once it is reacting with that, a cross-linked polyacid is going to form. Now this stage of formation of a cross-linked polyacid is also known as gelation. The next step is hardening. Now what does that hardening stands for? When the polyacrylic acid is going to react with the carboxylic acid, there is a cross-linked polyacrylic acid which is formed. This stage is going to last for 7 days. Its stages last for 7 days and the aluminium ions will provide the final strength of the cement. So first calcium reacts and then we have the aluminium which comes into the picture to give more strength. So basically what is the final product which comes? There is a cross-linked polyacids which is there as the base matrix. We have silica gel around and then we have a glass core inside. Because of the silica we have a glass core inside. So that is giving the entire strength to the material. Coming to the film thickness of the property, it is again for the luting it comes up to 25 micrometer. Working time and setting time. Working time we have got ample amount of working time, that is 3 to 5 minutes, and setting time is 5 to 9 minutes. The strength, compressive strength is very high, it's good to 230 megapascals. Coming to bond strength, it is 1 to 3 megapascal. The solubility is very high in first 24 hours, but then later on it gets into lower solubility. Coming to biological properties, because of the release of fluoride ions by glass ionomous cement, it's considered the best cement as a luting agent. Why? Now this fluoride ion which is released, it is karyostatic in nature. We'll come to that topic in some months. And how is that fluoride ion released? Till what extent? Till 18 months it is released. So what are the action of fluorides in prevention of caries? So since we know that fluoride is a content of glass ionomous cement, it has some action in prevention of caries. Now how does it prevent caries? Fluoride we know is a very essential karyostatic agent. So this fluoride is going to help in the prevention of the secondary caries. So because that is the reason stannous fluoride is used for caries prevention even in the community health purposes. So fluoride helps in the prevention. Fluoride ions are released and those will not allow the caries to carry forward. Similarly, another important thing about glass ionomous cement is that its solubility is little high. That is one thing. Second thing is reaction of the cement on the pulp. Now, because of luting cement, glass ionomous cement, luting consistency when we are mixing, though the film thickness is little more and higher than 25 micrometer in case of glass ionomous cements, the luting consistency is more acidic. So what happens, because of the more liquid that we are using for the luting consistency, it is becoming more acidic. So the reaction to the pulp remains acidic for at least a day or so, and then it goes to the next level of neutrality, that it comes higher, that is 6 to 7 pH after a day, but till a day it is more acidic. So the reaction of GIC to the pulp remains acidic for at least a day. Though that is mostly widely used luting cement because of its compressive strength, though it has got a high solubility, though it is used as a because it has got fluoride, which will act as a prevention of spreading of secondary caries. Application, it is used as a permanent cement, it is used as a base, it is used as a filling material in class 5. Pit and fissure sealants, again, why pit and fissure sealant it can be used as? Because of its property of fluoride, released till 18 months. Endodontic sealer, it is also used to lute the orthodontic braces and brands. Coming to hybrid ionomous cement. Now coming to the next cement, that is a hybrid ionomous cement. As the name suggests, it's a hybrid ionomous cement. So it is hybrid, it's a mixture of ionomous cement with something. So let's see what exactly it is. It is a self-cured as well as a light-cured cement, and composition is, it is a radioactive opaque cement first of all, so it can be seen very well in the IOPA. Fluoroaluminosilicate glass is present and a micro-encapsulated potassium persulfate is there. And ascorbic acid as a catalyst system which will enhance the reaction to go forward. The liquid is an aqueous solution of polycarboxylic acid modified with dependent methacrylate groups. It also contains 2 HEMA. What is HEMA? That is hydromethyl methacrylate and tartaric acid. So the manipulation of the cement goes 1.6 grams of powder is required and 1 gram of liquid. Manipulation of glass ionomous cement is also very important, and very notification is we take a paper plate and on that with the help of plastic spatula or a jade spatula we will mix the glass ionomous cement. The technique of mixing glass ionomous cement is also known as folding technique. Why is that known as so? Because you take the paper, you take the plastic spatula and you fold the material like this in this motion. So that's why glass ionomous cement mixing is also called as folding technique. Coming to the hybrid one, the properties remain. The compressive and tensile strengths are good enough. Bond strength to the dentine is 10 to 14 megapascals. Early pH rises again acidic, it is 3.5, but yes, it has also got the fluoride releasing capacity. The working time for these cements are around 2.5 minutes. Where we can use it as a permanent cementation, luting the orthodontic wires. Now yes, this is also a light curing kind of cement, so the strength is of course going to be more. Adhesion of liners for amalgam or braces and the provisional restorations. Coming to the next cement, that is zinc oxide eugenol cement, a temporary base cement, a passive cement in nature. One of the least irritant cement to the pulp. But of course, we lack the strength. That is the reason we are classifying it under the temporary group of cements. So types according to ADA specification number 30 is type 1 is used for temporary restoration, type 2 is used for permanent cementation or applicants outside the mouth as well. Type 3 is a temporary restoration and thermal insulating bases it has got. Type 4 zinc oxide eugenol is used as a cavity liners for endodont for conservative procedures. Composition in tube 1, that is a base plate, we will have zinc oxide 87%, we will have some mineral oil as well. Tube 2, we will have oil of cloves or eugenol. Now very important to note here, is it oil of clove or it is eugenol? Oil of clove is more acidic than eugenol. So eugenol is a refined form of oil of clove, so eugenol is better. So 13% of eugenol. Gum or polymerized resin, we have filler particle, that is silica 20%, we have resinous balsam and lanolin to increase the viscosity of the material. Properties coming to the setting time. Initial setting time requires 3 to 6 minutes, whereas the final setting time for type 1, that is a permanent restoration, goes to 10 minutes, type 2 goes for 15 minutes. So we are not supposed to add, but the solubility of this material is very high. So we are not supposed to ask the patient to drink water because that will react and dissolve the cement out. Film thickness for permanent restoration, type 1 is 25 micrometers to 40 micrometers. So for temporary restoration, the film thickness remains to 25 micrometers. Whereas for that of the permanent restoration, it goes up to 40 micrometers or even more. Coming to the disintegration, the solubility as I spoke is very high. So a maximum value of 2.5% acceptable for provisional cement materials, but 1.5% for those of the cavity liners or for the permanent restoration. Coming to the compressive strength, it's very weak. It is only 35 megapascals. Non-eugenol paste have come up. What was the reason of coming up with non-eugenol paste like Frigenols? That's a name, brand name, Frigenol. Now, why is a non-eugenol paste came up? Because eugenol has some activity, that is irritation to the gingiva, mucosa. So, that was the reason those patients who could not take the smell of eugenol, who could not take the reaction of the eugenol because allergic reactions happen due to eugenol, for them we came up with non-eugenol paste. So, how it happens? What is the material other than eugenol which is used here? So the material other than eugenol which is used here is EBA, that is orthoethoxybenzoic acid. And so carboxylic acid is mixed with zinc oxide here, and we found the orthoethoxybenzoic acid is formed. And this material was not as irritant as eugenol. So this was the non-eugenol paste which came over. Coming to the next one, that is resin-based cements. The resin-based cements are also known as the Japanese cements because it came out from Japan. So class 1 is classified in self-cure material, class 2 as a light cure, and class 3 as a dual cure. What does dual cure mean? Self as well as light. Both it cures. So composition, it has a resin matrix which will have what? It will have this GMA or diurethane methacrylate. It will have some inorganic fillers like silicon oxide. We'll have some organosilico coupling agent. We have silane coupling agents. We have silica or glass particles to give strength to the matrix. Monomers with functional groups like bonding to the dentine organophosphates. Hydroxyethyl thacrylate like we spoke before, HEMA. And 4-methacrylate, trimethacrylate acrylitine, that is 4-meta system. Light cure composites are also photoinitiated in the presence of camphorquinone amine system. Now camphorquinone is also present. Now initiator of any liquid or a powder has to have some initiation. That initiation will come from camphorquinone. Coming to the properties of resin cement. Coming to the physical properties of resin-based cements is the compressive strength is around 200 to 250 megapascals. The tensile strength varies from 30 to 40 megapascal. The modulus of elasticity, that is the strength of the material, is 4.5 to 9.8 gigapascal. The working time is 0.5 minutes and the setting time remains to 1 to 1.5 minutes. It shows a micromechanical bonding to the tooth. So they interlock with the hydroxyapatite crystals and rods of the edged enamels. Now this interlocking with the partially demineralized dentine by infiltrating into the edged bonding. So what happens when this infiltrating into the edged dentine, the micromechanical bond is getting more stronger. So it forms a chemical bond to the composite restorative material and porcelain and shows a good micromechanical bond strength to the sandblasted base metal alloys as well. For noble metals, they show a chemical reaction with that of the oxide layer on the metal surface which is present. Now coming to the advantages of this material is it has got a very high compressive strength, resistance to the tensile fracture as well, very high, virtually insoluble in the oral environment, improved marginal wear. Almost all the good characteristic of a luting cements are there in this particular cement. Cements containing ytterbium trifluoride releasing some fluoride amount as well. It has got good amount of shade matchability, so we have good shade variations in patient to patient. But what are the disadvantages of this material? We all know it's a resin based. When it is a resin based, any resin will undergo something known as, very common to us, polymerization shrinkage. So that means there will be shrinkage, there will be some space left over later on, years after, in between the restoration and that of the tooth. So increased viscosity is another disadvantage, and hence the film thickness is also important. It is very technique sensitive. Coming to the film thickness part, why is it sensitive and indicated like that? Because we told it's of T-type, class 1, class 2, class 3. It is self-curing, it is light curing, it is dual curing. Till what level light curing can work? Light curing can work till when the thickness is 1.5 mm. Nothing more than that. What will dual cure do to? Dual cure can work when the thickness left behind is 2.5 mm. Should not go more than that. So every crown has to be decided based on which material is used. The luting cement choice will differ. Now indications for these resin cements are, it is a cement of choice for aesthetic restoration for sure, because it is a very translucent cement including resin composites, all ceramic and fiber reinforced inlays and onlays and crowns and veneers. To the cement post into the implant body to serve as an abutment also, it is very important. The useful for preparation lacks proper retention. That is one where it is indicated. So these are all the luting cement that we use today, and resin modified cement is one of the most important cement that is coming up in the basic use as a luting cement. Thank you.